Hi, Dr. Penhollow with Precision Regenerative Medicine. We're talking about the lumbar spine today, the low back. This is the spine model. The low back consists of, from the inside out, the spinal cord, the spinal fluid surrounding the spinal cord, the spinal nerves that come out and go in very specific distributions down into the legs, around the hips, down to the feet. The vertebrae themselves, that is the bony protection cage, the discs that are in between each of the vertebrae that are cushions, the muscles, ligaments, tendons all overlying this and protecting things, and then we get to the skin on the outside. So people can have different pain generators when we talk about back pain. It can come from the discs, it could come from the bones themselves. If the bone has been fractured, it's called a compression fracture. It can come from arthritis of the discs. Basically, with age, they get old, desiccated, dried out, and as that occurs, then the disc space is decreased. It's almost like taking a jelly donut and squishing it out, and you can get herniations of the discs. Those discs can then create some toxic fluid or caustic fluid that gets on the nerve roots, and that can beget pain down in a very specific distribution into your legs, your hips, your feet. Can come from arthritis of the joints of the back. These are the facet joints right here. They're about the size of my finger joints, and they can also have wear and tear with time. Typically, that is described as a pain across the low back, kind of like you're wearing one of those braces, and it's worse with twisting and extending. That's kind of an evocative test or a provocative test to see whether or not that's what's causing your pain. So most commonly, I see patients with pain that is simply from arthritis, wear and tear of the discs of the joints. And that happens over time, or it can happen as a result of an injury early on that then begets a traumatic arthritis later. You can also have it from simple strains of the muscles. Low back pain is one of the most common reasons for lost work days in the United States. So people with pain in their low back can still sometimes get radiation of pain down into the legs if the muscles are tight or in spasm. We can treat low back pain with PRP, your body's own blood, or with bone marrow, aspirate concentrate, your body's bone marrow, which is drawn from the crest in the back that sit about here. We go into this area, we take out the bone marrow or the blood, we process them in the centrifuge, and then we're left with, in the case of bone marrow aspirate, stem cells, as well as platelet-rich growth factors and anti-inflammatory cytokines. In the case of PRP, or platelet-rich plasma, we don't have the stem cells, but we have all the rest. The one good thing about placing PRP into the area, if you don't need the bone marrow specifically, is that its very presence in an area that is super targeted and super concentrated can stimulate the release of stem cells. It's not as robust a response as actually putting the stem cells into the area. And again, let's be clear. I'm talking only about your body's own cells, because that's what I do at Precision Regenerative Medicine. I do not use birth tissue cells, amniotic, cord blood. Don't use them. Those are dead cells. We use live cells, your own cells, into the area in hopes to regenerate the discs, because we can put them into the disc space themselves, into the joints, into the epidural space, into the ligaments overlying, the tendons, the muscles. This whole area is treated. I don't simply place these cells in the disc or simply place them in the epidural space. This is a multi-layered, multifaceted treatment program, typically with one injection. And with PRP, I'm seeing a good 1 to 2 years relief, and I'm still looking at these same patients to see if it goes beyond that. And with bone marrow aspirate concentrate, we're seeing on the realm of 3 to 5 years relief. However, everybody's different. Your case is very specific to you. We would need a very recent, less than 12-month-old or 12-month-old MRI of your spine. If you cannot have MRI due to hardware in your spine, then a CT of your spine. These things are very precise. We need very precise imaging, and MRI is the gold standard if you're entering the epidural space, if you're entering the discs. And I would be happy to talk to you about this at Precision Regenerative Medicine, https precisionmedprp.com. Let's see if we can get you back to doing the things you want by addressing your back pain with your body's own cells, your body's innate ability to heal itself. This is if you've had surgery. This is if you haven't had surgery and you want to avoid surgery. This is even if you've done the other things like radiofrequency ablation, steroid injections, chiro, acupuncture, PT, different braces and medications. If that's not working for you, maybe PRP or bone marrow aspirate concentrate is for you. Thank you.